through the wilderness and track down that majestic beast, and we've stumbled upon a mythical body of water that few explorers have ever set eyes on. That's right, we've made it to the Hep C, home of hepatitis C. So grab a juice box and let's get started. If you recall, we traveled here from the desert oasis of the delicious flavor of flavivirus, because hepatitis C is a flavivirus. And since you know that, we know that it's a positive sense enveloped RNA virus. First, let's draw our explorer here making the find of a century while sipping on some flavorful Hep C fruit punch. Second, let's add this glaring sun to remind us that it's a positive sense RNA virus. You'll notice as the story unfolds that the scene has mostly warm, orangey hues to it to remind us of RNA. Finally, no explorer strays too far from the oasis of flavor to traverse the barren landscape without a trusty robed guide. So let his flowy, white, enveloping robes remind you that Hep C virus is an enveloped virus. Now, we've been waiting here patiently to catch a glimpse of the creature emerging from the water, and here he is, the hepatitis hippo. Remember that Hep C hippo is out at sea, as opposed to the Hep A hippo, which is locked in an enclosure at the Picorna Zoo. Additionally, the Hep C hippo has this ear tag reminiscent of the letter C. Alright, moving on. Let's go through some of the common modes of transmission. The most common way Hep C is transmitted is by exposure to infected blood, which is why we have the hippo here wading in red, bloody water. There are two common stories you'll hear about when it comes to blood-to-blood transmission in Hep C. One that used to be a major problem is transmission through blood transfusions, especially before 1990. So if you have a question stem with a patient who's received a blood transmission in the 70s or the 80s and are presenting with liver problems, think Hep C. The second is with IV drug users who share needles. So to help you remember this, let's draw this needle going through the hippo's left ear to accompany that ear tag on his right. Our hippo's starting to look a little punk rock. And some other bodily fluid exchanges that can give you Hep C can occur through the placenta, sex, and through breastfeeding. So note that Hep B is actually more likely to be transmitted through sex, but Hep C transmission is also possible. Okay, so that's how Hep C is transmitted, and unfortunately it's really infectious, more infectious than HIV, so it'd be great if we could prevent transmission. However, Hep C, like HIV, poses a real challenge for creating vaccines. Its envelope proteins often vary their antigenic structure, and our immune system can't keep up, rendering a vaccine obsolete almost immediately. So to help you remember this antigenic variability, we'll draw this multicolored tent here in the back. If you can recall, there was a similar looking tent of variable colors that was keeping one of the rhinos cool in the rhinovirus sketch. Now let's go into a little detail about how this variation happens. The virion-encoded RNA polymerase lacks proofreading exonuclease activity in the 3' to 5' direction, so the RNA is prone to frequent mutations. This means the structure of the protein is also prone to frequent changes. So how do we remember all of this? Well, we're going to draw on this sign here, and notice that it's grossly misspelled. It doesn't say hippopotamus, it says hippotopumsus. Looks like our desert natives can't spell as well as they make delicious beverages. At least they're not proofreading their signage. So this symbolizes the lack of proofreading, leading to high antigenic variation. And also the sign below it says no viewing from 3 to 5, which should remind you that it has no 3 to 5 exonuclease activity in its virion, which is the reason for this lack of proofreading. Alright, we just did some biochemistry and it wasn't even that painful. I'm starting to think we're onto something here with this whole sketchy micro thing. Anyway, before I get ahead of myself, let's get to the clinical picture of a Hep C infection. So obviously, as the name indicates, hepatitis C causes inflammation of the liver. So we'll add this liver-shaped mud patch to our hippo here. In the acute stage of viral hepatitis, this inflammation can lead to jaundice, which you can remember with our hippo being yellow. And other obvious findings of acute hepatitis could include right upper quadrant pain or discomfort, an enlarged liver, and increased liver enzymes. All pretty basic stuff. Now, in contrast to hepatitis B, in which most cases will resolve after an acute attack, 60 to 80% of hepatitis C infections will go on to become chronic. So we'll draw in a sign here next to the bloody red water that reads caution, 60 to 80% chronically infected hippos. Signs are pretty useless unless they're memorable, and admittedly this one's not very memorable, but maybe think of it as us taking notes for you. One non-sketchy approved way to remember this is to use the C in hepatitis C to remind you of its propensity to become chronic. In hepatitis C, lymphocytes will infiltrate the portal tract, and with the chronic inflammation and infection, hepatocytes will die. So what do you think will happen when the liver cells and parenchyma are chronically irritated and the liver needs to quickly start replacing dead hepatocytes? Well, there are two ways this can go. Some bits of the liver might just succumb to fibrosis and cirrhosis, just as this washed up, dead piece of liver-shaped coral did in this inhospitable sea. So let this fibrotic or cirrhotic-looking coral remind you of cirrhosis. Or alternatively, the liver can go into a frenzy and the reproducing cells can become malignant. So to remember this possible outcome, let's draw this crab here on the sand, which is the sign for cancer, specifically hepatocellular carcinoma, which unfortunately is a devastating outcome of chronic hepatitis C infection. Okay, so it's very important to figure out whether a patient has acute or chronic hep C and what stage. In an acute infection, you'll find hep C RNA in the serum during the first 6 months. The ALT will rise and then fall by 6 months. So to help you remember this, we'll add a buoy on the waves labeled with an ALT that rises and falls with the tide. In the patients who manage to get over their initial hep C infection, anti-HCV will rise after 2 to 3 months. This lag is due to new mutant strains that are being produced, again thanks to the antigenic variation. However, anti-HCV antibodies can be present in both acute and chronic infection, since the virus mutates so quickly. This means that the antibodies, even if present, soon become ineffective, which means there's no protection against recurring infections. So in the situation of a chronic infection, you'll see the viral RNA persists in the serum after 6 months. Additionally, if you do a liver biopsy, you'll see a lot of lymphocytes in the portal tract. So another thing to be aware of is that hepatitis C is associated with cryoglobulins, which are serum proteins containing immunoglobulins, mostly IgM, that will precipitate out in cooler temperatures. Cryo is from the Greek word meaning icy cold, so when you think of cryo, think of cold waters of the hep C as salt precipitates out on shore. Also notice these crystals here are 5-sided and look like IgM molecules. Again, this is to remind you that hep C infection can lead to the development of cryoglobulins, or serum proteins containing IgM that precipitate in cooler temperatures. Alright, so one more thing you need to know before we return to civilization. How do you treat hep C? Well, the old way to treat it, and you'll still see it in some textbooks, is that you can use ribavirin in conjunction with interferon alpha. So first we'll add some more death and decay to the salty shores of the hep C with these hippo ribs for ribavirin. To help us remember that interferon alpha is used, we'll give this flavor-loving explorer a walkie-talkie with a twisted antenna shaped like an alpha. Antennas can have interference, and for that reason we thought an antenna would be a good symbol for interferon. The alpha twist should also hopefully stand out in your mind's eye. Other drugs that can be used are protease inhibitors, and one of the newer drugs, sofosbuvir, is a polymerase inhibitor. And this has really been quite an impressive drug in ridding people of hep C infection. So you should remember to consider using protease inhibitors. And proteases cut up protein, kind of like a meat cleaver. So we thought a meat cleaver would be a good symbol for proteases. And nothing scares off the wild hippos more than a bumbling explorer who's been using his meat cleaver to hack away the vegetation to clear a path for their expedition, which now seems to be stuck in this tree. Try as he might, he can't pull it free, and his meat cleaver, or protease, is stuck, or inhibited. This should remind you that some protease inhibitors are used for treatment. I'm not going to go into specifics because, for one, genotype testing of the virus must be done to determine what combinations of drugs should be used. But hepatitis C has the potential to have terrible, devastating outcomes and is the leading cause of liver transplants, so we're definitely in need of some more great drugs to treat it. So this is a high-yield virus, and we got through it rather quickly, partly because we touched on it in the flavivirus scene.